My name is Jane Onken, and I'm a gastroenterologist at Duke. My area of interest and expertise is inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. I came to Duke in 1987 as an intern, and I've been here ever since. If you come to Duke, I will take care of you as though you were my own family member, and I think most of my colleagues would do the same. And I think that's also what makes Duke special, is that everybody really does try to make sure that each patient gets individualized care. I remember vividly, there was a young woman who had end-stage liver disease, and this was in the early days of liver transplant, and she would have been maybe the second or third liver transplant performed at Duke. And the attending physician was a wonderful man named Paul Killenberg, and he left me alone on the ward over here in Duke South with the patient who was really sick. And I remember I stayed up all night trying not to let this poor woman die so that she could make it to her liver transplant the next day. And I think it was a moment like that, if not that moment, that made me realize that gastroenterology was what I wanted to do. So she went on to get her liver transplant, had almost a perfect match. She's still one of the most successful liver transplants. I don't think she's ever had an episode of rejection in all the years since her transplant. I think I would tell a patient who is interested in coming to Duke that this is a place where not only do we have depth and breadth of expertise in the field of gastroenterology, but that every day, every one of us wakes up trying to do the right thing and trying to help the patients who don't have a diagnosis to make a diagnosis, who have a diagnosis and who are feeling sick to make them better. This is definitely the place where people try very hard to make sure that they do the right thing every day.